Hi, I'm David Levine. Thank you. This is SWINY's first Zoom broadcast. So I'm going to start. I'm going to introduce my friend and colleague, Doug Levy. Doug was the Chief Communications Officer at Columbia University Medical Center in New York City during the Ebola crisis, Hurricane Sandy, and its extended recovery, as well as a long list of important science news during his 5 years here. Before he worked at Columbia, he was Chief of Staff to former FDA Commissioner David Kessler, when Kessler was Dean at the University of California, San Francisco School of Medicine. That's where Doug was introduced to pandemic planning and response. He was on the committee that managed UCF's response to H1N1 in 2009. Doug was also a medical reporter at the USA Today for most of the 1990s. Doug has a degree in healthcare law from the University of Maryland. He studied science journalism at Northwestern University. He also has a history degree from University of California. He's joining us from San Francisco. I'm in New York City. And he has a new book out, which is we're going to talk about. It's called Communications Guide for Coronavirus, Best Practices for Business, Government, and Public Health Leaders. So Doug, I want to first ask you, why did you decide to write this book? I mean, it's timely, but when did you start writing it and why?
Thanks, David. And I am really happy to be here. The nice thing about having to do everything virtually is that I can be in California and still at a SWINY meeting. So this is a treat for me. To be honest with you, I started writing this book about 6 years ago, and I wanted to put together a textbook on public health communications. I wound up setting it aside and diverted to other things, including I did wind up writing a book on police and fire public information, which I'm proud of, and it's been a lot of fun working with that side of the world. But with the current situation, I dusted off what I had written before and adapted some of the things that I was writing for the second edition of the police book, and did a lot of writing holed up in a cottage outside of Seattle in February, trying to bring things up to date. There are many organizations, most organizations, I hope, have some kind of a crisis plan. Every hospital has some degree of even pandemic plans, but really, I don't know anybody that had a well-developed plan for this. And I don't have all of the answers, but we do know some things that work better. We know some things not to do. And particularly where there is a scientific subject involved, accuracy and precision of communications is so important. And part of what we started to see in February, for sure, was many people in government and elsewhere thrust into communications about COVID-19 without really understanding how to communicate about science and health. So my hope is that the book is a guide for both those individuals and the people that do it anyway and just need a reference point. And I also want to add that although the book, I updated it right up to the minute that my editor pulled it away from me on March 16th. But I'm already working on an updated edition, and I'm expecting that'll be out probably around the middle of May, just as this is a evolving situation. There are new things we're learning every day.
Now, your first book was called The Communications Golden Hour, The Essential Guide to Public Information When Every Minute Counts. And you write, so why don't you explain to me, since you write about the golden hour in your book, I did read it, so maybe you could talk about what the golden hour is and why it's so important, and also who you think is doing it well.
Thank you. I used to be an EMT and a firefighter ages ago in my spare time, and I learned, I was in Maryland, where the whole concept of a trauma system and ways to absolutely maximize the response to trauma injuries was really honed into me. And particularly working at Columbia, we had a tremendous pace of urgent media issues, just the nature of being at a medical center in New York City. I really got my team to focus on that initial response. If you look at some of the things that have gone wrong in the media, the United Airlines leggings mess is my favorite example, because it is a classic example of something that shouldn't have even been a news story. But an unwise corporate response to what appeared at the time to be a random consumer's inquiry turned it into a news story that not only was highly negative, but really had its own legs and was a major corporate crisis.
Okay.
Response to the inquiry been done with more attention to the possibility that it was more than it looked like, the whole thing could have been headed off. So knowing how do you respond, what tools do you have? Do you know how, when we had the fires in Sonoma County in 2017, nobody on duty in the county knew how their alert systems worked.
Okay. So since the book's about COVID and since everyone's, interested in, so Governor Cuomo has a daily briefing, which seems very popular. Donald Trump has a daily briefing, which has not gotten as good reviews. So what is Cuomo doing right and what is Trump doing wrong? And
well, I'm not going to say anything about reviews because that's not my jam. Okay. But the reality is we are getting to see many, many different styles of official communication. And I actually was listening to a webinar done by one of the people who I really respect in the law enforcement world earlier today, where she was really trying to guide mostly police chiefs on how do you manage communications when it's not really a police thing. In the past, and I remember, about 25 years ago, I gave a talk to the American Public Health Association where my main point was, if it's a health thing, get the governor out of the way. The health director should do the talking. The truth is, the magnitude of this emergency and all of its consequences take it out of the realm of the health director. It has to be the chief executive. But the chief executive also has to understand what their role actually is. And I think Cuomo has done a pretty good job of that. I'm not going to comment on whether his actions in response have necessarily, I'm not going to judge that. That's, again, not for me. Okay. But in terms of communicating, what he's done right has been, he's had a very clear sense in his own mind, clearly, of what to say. He's had a single clear message every day. And he also demonstrates that he understands who he's talking to, including that not everybody liked him at the beginning and maybe still doesn't. So his sort of folksy approach, the stories about his mother, those are devices that make his messages more, they sound authentic, and I think for the most part they probably are. He's also shown that he's got a good command of the facts.
He comes across as empathetic.
Exactly. It's like, He's sharing what his family is going through, acknowledging that he's got privileges that a lot of people don't have. But it's also been an authentic way to say, you know, I'm having to deal with this myself. I know this is hard. And I also understand it's harder for you, which is a really important thing. We're not hearing that from a certain swampy place further south.
Okay. So, all right. Okay. So there are a lot of hospitals, and we have a lot of public information officers, and so, you know, in a lot of hospitals, you know, communicating about it. There have been researchers. Last night on CNN, they had a researcher who was actually working on the new drug. You know, that's you know, they released the preliminary data, and he's talking about why it was important. So, okay, so in a hospital, who should be the person speaking? Should it be the head of the emergency room? Should it be the infectious disease specialist? Or it just depends on what the questions are?
That's a great question. And this is the sort of thing that ought to be figured out in advance, because you don't really want to be writing your communications rules as you're going along.
Okay.
You know, who is authorized to speak? And is that person speaking on behalf of the institution, or speaking personally, or something else? And that's a tough thing. You know, what if a TV crew shows up? Obviously, they're not going to get into the facility, but, you know, what should a staff person do if they walk outside and there's a... Think about those things ahead of time. In terms of who should be speaking, it depends on the story. If it's about capacity and cost and staffing and government participation and coordination, that should be either a CEO or a chief medical person. So the head of an emergency department could be a reasonable person to speak. The head of, you know, the chief nursing officer often is a good person to be a spokesperson. But if it's about, you know, dealing with surge capacity and things like that, where you're bringing in other units to the hospital, it's really got to be somebody even higher. That's where the CEO should be mostly involved, especially because you don't want to take the nursing supervisors or the emergency doctors out of their patient care role if they're really dealing with the patients.
So you're talking about the book, how people should be ready in advance. I mean, and so could you give some of the acronyms that you use?
Sure. I may have a slide here for you. On one of my screens that I can't see right now. But what I try to get people to think about is a systems approach to communication. So just like emergency medical services, think system. It's not just the ambulance, it's the ambulance, it's the fire engine, it's the police officers sometimes, it's the personnel at the hospital. Each person knows their role before the alarm goes off and before you show up taking care of the car accident victim. And understanding your role, regardless of what the specifics of the circumstance are, is really key. So in order to be an effective communicator, you have to be trusted. That's not something you can do overnight. So if you haven't already established trust with whoever you're communicating with, well, get started now. But understand that trust is something you earn, and it's usually something that takes time. So I'm using the acronym TRAUMA. So trust, that's the T. R is rapid. The news moves faster than ever. You can't hold things back if it's news. If there's a truck being loaded with bodies that can be seen from the street, you can't wait till the next day to tell people what that is. the faster you respond and at least acknowledge that you're working on an answer, the more credible you'll be. The New York City Police Department has actually gotten this down really, really well. Their standard is now a social media message of some kind within 20 minutes of what's considered a critical incident. Sometimes that message is officers are responding to the report of a stabbing on the West Side Highway. Or units are responding to a situation at a particular location, details to come. That lets people know that you are hearing them ask questions. And that's really important, because if you don't acknowledge, somebody else is going to start giving information. And usually that's not going to be somebody with real information, with answers. That's how the false information gets promulgated. That's also where A comes in. So we've got trust, rapid, accurate. There is no room for mistakes. I mean, honest mistakes happen and they can be corrected, but accuracy is paramount. So particularly in an emergency situation, anything that's sensitive, even if it delays the message by a minute or two, get somebody to read it other than you. The best of us make mistakes under pressure. It happens. We omit words. I've seen people get directions wrong. I've even seen emergency message going out without giving the location, so nobody really knows what to do. So accuracy, absolutely important.
Okay. So I've known Anthony Fauci a long time, having worked at the Lung Association, as a reporter at other places. The American public, he's probably, relatively new. I mean, but he has become instantly credible. He's actually satirized on Saturday, Brad Pitt plays him on Saturday Night Live. What makes him such a credible spokesperson?
There's a couple of things. One is, he's got the legitimate credentials. The man has been the nation's top infectious disease expert for more than 30 years. David, you and I are.
He comes across as, okay, go ahead.
Yeah, he has the right background. He is able to put what he says into pretty good plain English. Mm-hmm. He knows who he's talking to, and if he's talking to a scientific audience, he will sound different from if he's talking at the White House platform. He does boil things down to that single key message. And you know what? He doesn't look like he's making stuff up. He presents well, but he doesn't look like he's gotten a freshly tailored suit just to be on TV. It's clearly not his main thing, and that boosts credibility.
Okay. So, what organizations out there are like either government, or is there a certain university you think that's really excelling in this? I know Johns Hopkins has they provide data and they maps and things, but is there people you look to for, who are good examples?
Well, I do think that Johns Hopkins absolutely stands out here, and I actually don't know the backstory about who did what when exactly, but it began with a group of folks at the Hopkins Bloomberg School of Public Health who put together the Arctis map system to start compiling all the data, and that there was a real need for that because there was no other source that was pulling in data from multiple places. And pretty quickly, the university realized, oh, this is a thing, and they started pulling together other information, whether it was research studies, comments by experts, the full range. And the daily update that they distribute by email is pretty darn good. I think All right, I don't want to point to places that are not doing a good job. There are some. There are some individuals who I think stand out as well. Michael Osterholm from Minnesota. I mean, again, we know him from his CDC days. The man knows how to communicate, and he's used his credibility and he's got the ability to get on TV and make comments in a way that he doesn't have to worry about the political impact, and that's really important. Scott Gottlieb is another. I don't think this is why he left his role in the government, but God bless him for stepping up and realizing that people are actually listening to him. So he is filling a need as a policy guide to the science. Normally, we would have that from within the government. It's kind of sad that we don't have that right now.
Okay, so I'm going to open this up to questions. If you have a question, I guess just either raise your hand or you can submit it by writing. And okay, so if you have a question, let me know.
And it looks like we already have one.
Okay.
This is from William Schultz. When journalists wish to speak with people not designated to speak, what do you do? That's a tricky one, and it depends on the kind of organization you're in. If you're an academic institution, you let them speak because you do not want to be infringing on academic freedom, and that's a big deal. It is helpful to let people know how to make media activities go better, but you want to avoid saying no. If it's a healthcare situation, a clinical situation, you do have to remind people about HIPAA and other privacy rules. HIPAA is one of those incredibly misunderstood regulations. There are a lot of clinicians that don't realize that certain things they say that they think are not protected health information might actually be. So that's why it's important to have people trained. But it's also important to have more people available. If you've only got one person designated as an official spokesperson, well, that person's not going to be able to take all the calls. So that's not a recipe for success. Also, equip your staff with a response. If they don't want to talk to the media, they don't have to. So, one good way to say it is like, hey, I'd love to talk, but I've got patients to take care of. Let me give you the phone number of our public information office and they'll hook you up with somebody.
So here's a question from Alicia Holtz. She wants to know, would you please complete what you were going to say about your acronym TRAUMA?
Oh, sure. So trust, rapid, accurate, measurable. You always want to see if what you're doing works and whether it's an emergency or not. That measurement piece is important. If you're telling people to evacuate a building and nobody evacuates, you know that you did something that wasn't good. So you need to fix it for the next time. And A is accessible. And I mean that not just by, can people read it, or is the message available to people who are hearing impaired or sight impaired, but is the language accessible? Are you using language that people can actually take in, especially under pressure? Remember that when people are afraid or emotions are charged, brains go to jelly. We know that. Ours do too. I tell people, presume that the IQ of your audience is half of what it is normally because they're afraid.
Okay, so we have another question. This is anonymous and it says, what is your opinion of how the Mayo Clinic should have responded to their lapse in allowing Vice President Pence to enter the hospital unmasked?
Yeah.
To me, that's kind of a tough question. You can't order the Vice President around, I guess.
Oh, yeah, that's debatable.
That's debatable.
So in part because I know quite a few of the folks at the Mayo Clinic, I have chosen to not look at the close details of who said what when, but I certainly saw that they posted a tweet and took it down. That is not a good practice. If you're a government entity, that's not even legal, but even a private entity, you really don't want to get into that situation. So there was a breakdown in the decision making there. Having been the point person for VIP visits to medical centers, what does not make sense to me is how that hadn't been addressed in advance.
Okay.
And I have to think that the vice president was notified and there was nobody who stopped the entry until it was too late. And I guess to some extent, they should have anticipated it.
There's a very clear sign when you go in that you have to wear a mask. So
Yeah.
I guess, so what was their choice? I mean, they could have said, no, you can't go in.
Yes, they actually could have. And in fact, that would have happened in most places, honestly. I remember the very first highly secure place that I worked, my day one briefing included what was the protocol for a presidential visit. And part of the protocol was that the security rules for that property governed even the president's security detail. Now, obviously, there's got to be negotiation with the Secret Service. Does pretty much the same thing. But rules are rules, and they're there for a reason. And I think the reason why the mask was so offensive to those of us who work in healthcare is that the reason for the mask rule is for patient safety. You don't set patient safety aside, period.
Right. And also the other one is that the rules don't apply to everybody, but they should.
But they have to.
They have to, yeah. So, but I don't see another question. Does anyone have a question? Or you can raise your hand if you want.
I actually see one there about how do you get TV reporters to understand the science that they're talking, that they're not getting. And this was a huge problem during Ebola. I remember that first day really, really well. And that was a huge challenge. We were used to dealing mostly with science reporters who do their homework. But the day that Craig Spencer was rushed to Bellevue, now it was everybody. And my team, we had to spend a bit of time on the phone with reporters who had never covered a science story before. And step number one is when you're talking to a reporter who you don't know, come up with a respectful way to gauge how much they know. Most reporters don't want to get something wrong. They just might not realize that they're wrong. So, something that I've done, I'll call up a reporter and I'll say, would it be helpful to give you some background on how the epidemiologists do this kind of calculation? And sometimes they'll say yes. If they then consider maybe not helping them at all, because if they're going to get it wrong, you don't want to be participating.
Okay.
Reporters are challenging. I mean, they could quote you, which, I mean, heck, that's the job. But in many cases, they just don't know where to turn. One of the things that I've noticed, unfortunately, in a lot of coverage, has been confusion over different medical specialties or scientific specialties. And I think this is something where all of us, whether we're PIOs or writers, it's a chance for us to really help. Certainly, epidemiologists, they do understand a lot about genetics. They do understand about clinical care and so on. You don't want to be interviewing somebody who's a PhD in epidemiology about the hands-on patient care aspects of a disease, not as your primary authority. They have a role, but they're not the main person. In the same way that you're not necessarily going to have an emergency department physician comment on population dynamics and the community epidemiology stuff. Again, it's science that they're familiar with, they're paying attention to, they may be able to explain it, but they're not the primary expert on it. And with a story like this, you have to have multiple experts to do it right.
And I think also people, this is not only a health story, it's a business story, it's a supply chain story, it's a vaccine story. So it's kind of hard for one journalist to be able to be an expert in all these things. Or it's also hard for, when they come to a university and they ask about economics, the economic impact, the doctor is not the right person to be speaking. So I think it's a tough. First of all, it's the overall story, probably of decades. Some people say it's our World War II, and the other thing is that it's a story without, no one knows how it's going to end. So
nobody knows how it's going to end, but we have an opportunity to influence the direction. This is me being maybe a little Pollyanna, but I got into journalism because I do believe that people who are better informed are able to make smarter decisions and engage more constructively in managing making their community better. If we do a good job of informing people why the physical distancing is so important, or what the risks are if people reverse course too quickly, then we are empowering people to make their own personal decisions better. And look at Georgia. The governor's done what he's done. Many of the businesses have said, we're still not going to open because it doesn't feel right to us. Or the casino owners in Las Vegas. The CEO of one of the big casino companies, when the mayor of Las Vegas, who doesn't have authority over the casinos, was saying they should be open again, he went right on TV and said, no, because what we sell is we can't do that if people are afraid to be here. We have to find ways to make people comfortable. That was a pretty effective message. We've got to find the right balance. And we also have to point out to people what works and what doesn't. Again, Scott Gottlieb this morning, one of his tweets was, he was showing charts, I think they were from the New York Times, on the states that are not going in the right direction. So, we have good news in South Dakota, which I'll be honest with you, that surprised me, but that's good. Their caseload is the rate of increase is going down. But you have places like Maryland, Massachusetts, North Carolina. I think Georgia was one of them. There's 6 or 7 states that started to slow down the increase, heading toward flattening the curve. And now the cases are accelerating again. So the curves are they did kind of a U-turn. That's exactly what we need to not see. But
I also think in Germany, they started making, relaxing things, and their cases going up. I mean, I think when you relax things, cases will go up. The question is how much. And, and then there's, I think it's also, important to look at other countries and see what they're doing and whatever, because they don't do it. They do it like Sweden's rules are for the whole country. They don't do it. Okay, this is a small city. this is a different, part of the region. I mean, Spain is uniform, Italy is uniform, and they do that. The United States, we're not doing that. Now, if you have a bad leader like you do in Italy, possibly it's not a good idea. Or if you have Boris Johnson who says, I'm just going to shake hands, and then he gets coronavirus. I mean, that's not a good idea too. A lot of people will say, well, we wish Cuomo was running things, but he's not. And so, I mean, so here it's different stories, but we do have, obviously, Fauci keeps saying social distancing works. They know it works and stuff, but, people are starting to get crazy and they want to go outside, which I understand. So
the part that is missing is a clear, consistent message, and that's the unfortunate part here. If you go back to the federal pandemic guidelines, the National Health Security Plan, it used to say that a clear, consistent message from the federal government was really crucial to addressing any kind of emerging infectious disease. We don't have that right now, so there's much greater confusion. But that's where, we have governors stepping up who are more unified than you might expect, and I mean, with a couple of exceptions, of course. But when you've got folks like Mike DeWine of Ohio, pretty much walking in lockstep with Cuomo in New York and Newsom in California, that's a pretty good thing. That helps the communication. But overcoming the confusion from the federal government is challenging, and it's also really sad because, I mean, for example, the CDC did an update to the COVID-19 symptoms. Didn't tell anybody. They put it up on the website, but
that's not good enough.
No, but their briefings have been muzzled essentially.
I know. Yeah. So
they appear that way, and that's a huge problem. But that's why the academic scientists are so important. And we have a question about how do you announce study results that involve treatment. If you followed the news yesterday,
the question is to talk about best practices for communicating about new papers reporting preclinical research that could lead to COVID-19 treatments. So I guess
well, if it's preclinical, I don't think you should be communicating about it. I mean, if it's preclinical and it's going to be in some major journal, I suppose you have to. But there's 69 compounds at least that have been identified as possibly active against COVID-19 already, and there's going to be more. Some of them are going to work, some of them won't. Some of them will work a little bit, but there's existing compounds that have been cleared for use. Okay. So unless there's something sensational preclinically, I don't think it's responsible to communicate about preclinical results, and that's true under normal circumstances too. I do think if you've got a fabulous microbiologist or whoever who can talk about the research being done on treatments, who can put some of the clinical research into context, maybe in that conversation you can tell a reporter, we're seeing in the lab some encouraging results with some other compounds, but it may work in mice, but it doesn't necessarily work in humans. That's
I mean, so the drug that was in the news yesterday, I'm not pronouncing it right, Resor something, whatever. So Fauci spoke about it, but then they also had on CNN last night the person who's involved in the clinical studies, and he explained very clearly why. He said, and I said, why, it's only, if it shortens your stay 4 days, why does that matter? And he said, well, it's 4 days you're not being exposed to other things. It's 4 days you're not in the hospital. And he said he thought that was a major thing. Fauci also was very excited about it. That's why, and he talked about it. I mean, and he's usually very careful. So that's why I thought, okay, well, I mean, there was no placebo group, as people point out. It's preliminary data. It hasn't been published yet, it hasn't been reviewed by other people, but they felt it was important to get out.
This was a placebo-controlled trial. That's what made it significant.
Okay.
So actually, this is a great example. There were 2 different studies released yesterday. One was published in The Lancet by a group of researchers from China that showed no effect, and in fact, they halted the trial early because there were some negative effects. A more recent study that was sponsored by conducted here in the United States, they've essentially halted the trial, or they've unblinded it because they were seeing such a clear effect that it would no longer be ethical to continue giving placebo. And that's kind of why the announcement was made yesterday. And it was done about the best way that it could be done. I mean, normally this is something that would get published in a clinical journal like the New England Journal of Medicine, but because it had that immediate impact on patients, it had to be announced publicly very quickly. And because it was produced by a commercial entity, Gilead had to put an announcement out before the stock market opened,
Right.
which complicates things. But I think most of the stories did get the idea that this is progress. It's not definitive by any means, but it's better than what we had 2 days ago.
Okay. Is there another question there? Let's see. Let's go down here. Okay, so given the vocal open up and anti-vaxxers, how can one communicate clearly to them the consequences of their demands? And then a related question is, the reopening of America is difficult to capture in a simple message. How can science communicators help bridge government, economy, and health interests?
One of the biggest challenges here is that because it is happening so quickly, because so many different people are involved, and because things have become hyper political, that's happened. We can't stop that now. There's been a lot of messaging that is not what we would come up with if we were starting normally. So I actually don't think we should be referring to opening up. You know, restarting things, sure, but it's not like everybody is dead. A lot of people are. That's important. We want fewer dead. But restarting business, you know, reemerging from our homes requires the situation that caused us to go into shelter to change. Well, we don't have definitive treatments. We don't have a vaccine. We have to keep educating people on why the physical distancing is so important. And you know, the shift from social distancing to physical distancing as a key message is important, because we want people to be interactive, but spaced out. The messages have to be tailored very carefully to the specific audience. You know, there are a lot of people that would like to go to Costco or whatever. They think that it's safe for them, but you know, find somebody that they will listen to. You know, sometimes it's going to be a scientist, sometimes it's going to be their neighbor Joe from down the block, religious people, community leaders. But you have to make it personal to people. The other thing too is think about new ways to convey the same thing. You want it to be tailored as much to your specific community as possible. So you're not going to make a joke about, well, you shouldn't be making jokes about this at all, but you're not going to make references to Mardi Gras unless you're in Louisiana, probably, because it's not going to really be that important. You're not going to talk about resuming hockey games if you're anywhere other than maybe Michigan or Canada. But you might talk about water polo or tennis or golf, relate to the audience and translate the science into how it affects them. The other thing is, don't use the same message over and over again. You do want to repeat the same information best as you can, but come up with new ways to convey the point.
I think in many ways that, I mean, they talk about vaccines every day. You have to have a vaccine, you have to have a vaccine. I don't think there's going to be much opposition from anti-vaxxers when there's a vaccine for COVID, as there is for, I know tons of people who won't get the flu shot. No matter how much I explain to them, you can't get it. Every time I get the flu shot, I get the flu. But I think in this case, where this disease that makes you stay inside, makes you die, and very, very sick, and it's very contagious, I think people are going to be it's going to be hard to get a vaccine. They're going to, it's going to, I was told, at the Lung Association when I worked there, they said, what's the best way to get people to get the flu vaccine? I said, announce there's a shortage, because people are going to really want the vaccine then. And people lined up for the H1N1 vaccines. And I think people are going to be lining up for this vaccine if they have one. And
as you say, if you get this vaccine, if it's ever available, they'll still need a flu shot. And yeah. I mean, the encouraging thing is that a lot of people have stepped up and acted responsibly and and sacrificed some of their own freedom and fun or work in order to protect others. And that's a really good thing. We should celebrate that. I think the other thing, which is, you want to tell people what they can do instead of what they shouldn't do or can't do. The anti-vaccine crowd, part of what motivates them is that there are people who are trying to tell them they're stupid, they're ignorant, they're whatever, and you shouldn't listen to them or whatever. Well, it's more important that we educate everybody else about how vaccines work, why they're safe, and why it's important that as many people as possible get them. People want to take action.
All right, so Debbie Irwin has a question, which I think is interesting. Not a question, but on the topic of novel ways to disseminate information. There's a program that started in Brooklyn where African-American barbers were given basic information about prostate cancer testing so they could raise awareness for their clients who weren't getting the information otherwise. This is actually was done nationally, adopted nationally by the American Cancer Society, and it's very successful because a lot of people get information from their barbers in the Black community.
Absolutely, and I gave a talk at the CDC, gosh, about 15 years ago, where I talked about exactly that kind of sort of indirect messaging. You want to find the people who actually are going to get listened to. Mm-hmm. I mean, about COVID-19, we've had messages from Tom Hanks and Kim Kardashian and Idris Elba. I mean, celebrities actually do have a role here. Every communications plan should include a list of community leaders that you can route messages through. You need to have their trust so that when you need to call on them to extend your messages, that you'll be able to do it. Very, very important. And I also see the question I left: understand your audience, which includes understand who they'll listen to, understand what languages they speak, understand if they have any limitations. There are a lot of communities where there's high concentrations of people who speak different languages, or maybe there's folks with hearing or mobility issues. A message to a community with a very large number of elderly people must be different from messaging to places with lots of little kids, because the older folks are going to have different issues when it comes to taking the action that you want them to take. So these are all the factors that should be thought about and anticipated ahead of time.
So someone, going back to trauma, someone said, why don't you say them again? Because someone said, what's the...
Sure. So it's trust, rapid, accurate, understand, measure, and accessible.
Okay. And the next question is, what lessons were learned from the AIDS epidemic or Ebola that seem to be overlooked right now?
Great question. So I remember when I first started covering the NIH in Washington, that would have been late 80s, early 90s. We were still struggling to have good tests for good blood safety tests. And every reporter on that beat learned about sensitivity and specificity of different tests and different testing technologies. Very few people are talking about that right now, and we have, I think, 67 at last count, different tests actually in use across the United States right now for COVID-19. And hardly anybody is mentioning that we really don't know how accurate these tests are. And we don't know if a test done in California is comparable to a test being done in Massachusetts or New Jersey or Georgia, whatever. If they're all using different testing technologies, it's apples to oranges and doesn't really help us figure out what's going on. We've got to educate people more about science because that's hugely important. I think that's probably the biggest thing. People don't understand how the science works. And I actually think educating people about process is helpful.
Okay, and someone wants to know, do you think we'll have a second wave of COVID-19? And if yes, what, if anything, should be changed about messaging?
Oh, great question. I mean, based on the data that I was looking at this morning that Scott Gottlieb tweeted out, some places are kind of already getting their mini second wave. This is, I think, where we should probably put some energy as a society, because I don't think the people who are clamoring to end the shutdowns realize that if there is a real second wave, it's not that we just have to shut down for a brief period. It's that we kind of turn back all the way to where we were in February. Mm. You know, and Dr. Fauci has described this a lot, but you know, he's got conflicting messages from his bosses, unfortunately. But the thing is that all of this pain that we've experienced is going to pale. It's going to be worse. You know, I think the best we can do is point people to history. I mean, there's sadly a lot of examples from 1918 of, you know, San Francisco had the anti-mask brigade that campaigned against the public health department that was being very proactive against the flu. And a lot of people died because they were persuasive. In the military, a lot of military deaths in the 1918 flu. Many of them were preventable. It was because they relaxed the standards a little too quickly.
And also there was a war going on, so a lot of soldiers were together. So that's another thing. So someone asked, what can we do better?
I do think we do, you know, as communicators, as institutional communicators, I think that we should try harder. And people are already doing this, but we need to do more informal education. So even, I mean, if there's a breaking story today, it may not be the right day to do it, but call back tomorrow and offer the reporters additional information. Let them know how to learn more about that aspect of science. You need to get the media to be much more science literate in order to convey the information to the public, which also needs to be more science literate. And it's going to take time, but it's a process and it's really important. People need to understand how vaccines are developed. It's not just punching a bunch of things into a computer and spitting out a formula. People don't understand why the flu shots don't really work so well. There's science on how to improve those. It hasn't been a priority. this might be the time to tell some of those stories.
Okay, so we're going to end here with the questions, but okay, first of all, why don't you show your book? And where can people get your book?
The book is, if you want to order it directly from publicsafetypress.com, that's one way. You can order it from almost any bookstore except Amazon. I don't really know the reason. Actually, no, it's on Amazon now too. So you can order it from any bookstore. It'll come quick if you order it from Barnes & Noble. The book distribution system is very confusing. It's also available as an ebook, which is probably the handiest way to do it. So,
Okay.
and I would welcome questions, comments, feedbacks. As I said, I'm going to be doing the next edition of the book within the next 2 or 3 weeks, and I would really welcome thoughts and comments on that. Can I give my email address? It's
Sure.
Doug@douglevy.com or DLEVY@NASW.org. I'm a proud National Association of Science Writers member going back a long way.
Okay, so we're going to do some, since we can't have meetings, we're going to do a talk hopefully with Rockefeller scientists, and on May 14th, we're going to interview, Chip Fisher is going to interview Gerald Posner, who wrote the book Pharma, which is a very good book, and he's he's a runner-up for the Pulitzer Prize, so I'm looking forward to that. And we'll keep you informed through our mailing list of upcoming events. So anyways, I want to thank Doug for taking the time to do this. We had quite a few talks. We had a rehearsal this afternoon to make sure everything was working well on Zoom. And I want to thank everyone for participating. We had over 40 people participating. So thank you very much.
Thanks, everybody.
Okay.
Stay safe.